Time for episode 5, how to manage your thoughts while you're going through the process. So again, just to recoup, what are we talking about when we're talking about mental? In this case, mental doesn't refer to emotional or psychiatric or psychological issues. It's really about how is my mind working, how's it thinking, how's it actually managing all the information, how's it thinking about my expectations, and all sorts of other things. This is sort of like the mechanics of how we think rather than what we're thinking about per se. So there's a couple of things I want to talk about. Managing chemobrain, learning the routine, making it easier to follow, and how to manage your medical visits. You may have heard about chemobrain during your chemo teach, but basically, just to review, it's a clouding of mental functioning that leads to making it difficult to pay attention, difficult remembering information later, feeling kind of disorganized or overwhelmed, taking longer to finish ordinary tasks, kind of like your head's in the clouds. It's caused by, well, any number of things. And in fact, they don't have a really good understanding of the specific issues that cause chemobrain, and it's probably all of the above. But the basic side effects, the common things that may be related to it, are some of the drugs that are used in the treatment, like the anti-nausea or the narcotics or the anesthesia, steroids. These are all things, opioids, those are all things that matter. Sometimes when people have a low blood count, that's a result of the treatment and is evidence that the treatment's working, but sometimes the low blood count makes it hard for us to think. As you might guess, if you're not getting any sleep and you're totally tired, that is a major factor. And that would be a major factor even if you weren't in treatment. But when you are in treatment, it's a big deal on top of everything else. In some cases, people have an infection like a pneumonia or some other infection in their body, and that can also challenge our immune system and take energy away from our ability to focus. Hormone changes are a part of it in some cases, and in fact, hormones are a focus of treatment. There's a whole range of treatments that people are on that are hormone-based, and when you're on those, sometimes that's affecting, certainly it's reducing your risk for cancer, but sometimes it's also making it hard to stay focused. And then, of course, some of your other illnesses, if you have any, like if you have diabetes or you have high blood pressure, and if those are not well managed, those can also affect how you're thinking. And as we've talked about in an earlier episode about eating, if you're not eating enough or you're not getting enough nutrition, sometimes it's hard to focus. And that's something that we can, we talked about before, and we certainly want you to ask us about if you have any questions about it now. And then finally, depression or stress or anxiety, those can also contribute, not only in terms of sapping your energy and taking energy away from what you want to pay attention to and focus on, but also sometimes you just feel so overwhelmed by all that's going on that it's hard to focus on the stuff that matters. For any of these side effects, I just want to say that there are ways to fix any of them. So no matter what the cause of the chemobrain, there are things we can do to help minimize its impact on you. So what can you do about chemobrain? Well, if you're taking a treatment that causes it, you don't want to stop the chemo or the hormone treatment or whatever it is, because that's actually getting rid of the cancer. So what do you do to kind of manage the chemobrain? That's something we can help you with. So one thing is to use a detailed planner, or for some people who are using their smartphones anyway, keeping everything in one place can really make it easier to find reminders and set yourself up so that you're able to know where you're keeping track of information as well as what kind of information you're keeping track of. To the extent that you can, setting up and following a routine can be really useful. So as we've talked about in an earlier episode around sleep, going to bed at the same time, trying to get up at the same time, having a same daily schedule will reduce the amount of energy you need to focus on all the other details that are floating around. Exercising your brain, kind of like exercising your body. If you take small doses and try to keep your brain sharp by doing word puzzles or reading magazines or newspaper articles, that can sometimes help. Some people like to read novels, but what we found is that if you don't have a lot of energy, it's hard to sustain focus throughout a whole novel. So sometimes things that are a little smaller doses, like a magazine article or a newspaper article, those you can kind of get through before you run out of energy. So that'll help you feel a little bit more successful, but also keep your brain sharp at the same time. Again, get your rest. It's always important, even now. It turns out, as we talked about earlier with the exercise, moving your body does in fact help keep your mind sharp. Partly because keeping the blood flowing through your brain and through your rest of your body helps improve your focus, but also getting some exercise can improve your mood and make you feel more alert, which helps reduce the effects of chemobrain. Other things you can do, well, if you're going to be eating small doses more regularly, try eating vegetables that are linked to keeping healthy brains. And those are all the leafy green vegetables that you've heard about. For more specifics, we encourage you to talk to our nutritionist. But in the end, leafy green vegetables are really good, and they're good for you. A memory center is just my little way of talking about having a same place to put stuff. So when you come in your house, you may want to dedicate some chunk of your kitchen counter or a table or something where you just put all the things you want to keep track of. That's where your purse or your wallet go. That's where your keys go. That's where your phone charger should be. That's where your calendar should be. And then if you're wondering, hey, did I write down that message? You go to the memory center and you have a place to look and see, oh yeah, Dr. So-and-so called and I wrote it down right here. Just having that, knowing that it's all there, helps reduce the amount of energy you need to keep yourself focused. Now, in this current day in life, everybody tries to multitask. It's just something we have to do. But if you're feeling like your brain is really fuzzy, we recommend just taking a step back and trying to focus only on one thing at a time. You can go from thing to thing, but just try to focus on one thing at a time. You'll feel like you do have enough energy to do that one thing, and then maybe you take a little rest, and then you take on the next thing. As you may have remembered from a prior slide, a prior episode, work a little and rest a little. That'll help keep your brain sharp. And then don't be afraid to ask for help when you need it. Friends and loved ones can help with daily tasks to cut down on distractions and help you save mental energy. Some things you don't want to let people do, other things it's fine to let them do. Talk with your friends and your family about what they're willing and what they're able to do, and also just what you need. It's okay to ask. What's true about chemobrain is that it won't last, but it is something that can get in your way in the meantime. So again, let us know if it's happening. We want to try to help. Key mental coping strategies, in addition to what we've just talked about, are learning a routine, managing your medical visits, asking for help, and how do I know if I need professional help? So learning a routine, it's kind of like, this is both mental and emotional, that if you have a plan, you can anticipate what's going to happen and you can be better prepared to manage it. If you follow that plan, then you'll be able to manage it as you had expected, and that's going to help you get through it. So have a plan and follow the plan. Two main ingredients to managing mental challenges as well as emotional, but we'll talk about that later. This is a little graphic that is basically just a way of kind of keeping track of what your overall treatment program is like. And at the top, you can see goals of care. And that's a conversation you want to be having with your family and your doctors. What you're going through all this for, what your hopes are. The more your doctors know about that, the better they can help you get there. So don't ever hesitate to ask for a conversation about goals of care. And then along the left-hand margin or column, there's supportive care, which basically means if we did nothing, what are the upsides to that? What are the downsides to that? What are the likely outcomes? You may already have gone through some of this with your doctors. Surgery is an option for some patients, and there are good parts and downsides to that. Chemotherapy, radiation, and then nowadays there's all sorts of other treatments as well, hormone treatments, targeted therapies, And this is just a graphic, and you can print this out, or we can give you a paper version of this. It's sometimes helpful to have a place to kind of keep track of what's the positive and the negative of each of these kind of treatments I'm getting. And if you ever want to get a second opinion, you can then take the same form and go to another provider and say, hey, listen, I've got this diagnosis. What can you do for me? And they'll help you think through other potential surgery, chemotherapy, or radiation, or other kind of treatment options. And then you can be able to compare and contrast and help yourself feel confident that the treatment plan that you're getting here at the Vernon Cancer Center is state of the art, which it is. So one of the things about getting through cancer treatment is that there is a routine, and you'll get to know it as you go through it. In the beginning, if you're looking at this video before you've started treatment, it may all seem really overwhelming. There's just so much to do and so many people to meet, so many appointments to keep up with. But over time, you will learn your way around the place, and you'll learn to know how it feels. So each treatment, you should know, has a very specific schedule, both day to day as well as over the long run. And you're going to be able to learn that, and you will actually be able to map it out on your calendar so you know what to expect when you're getting your treatments right through to the end of treatment. Because they're very specific, and you'll get it either on a weekly basis or an every 2 week or every 3 week. It really depends on your treatment. And your doctor and the nurse practitioners and the nurses will be very good at helping you understand what that schedule is going to look like and what you can expect. If you're getting chemotherapy or radiation treatment, you're going to have a primary nurse, one who gets to know you and will see you through each of your treatment sessions and will help you figure out what you need and what you don't need while you're going through treatment. They're really going to be your best buddy. The more you tell your primary nurse, the more they can help. And also, they like to know as much as possible about how you're doing. So if you tell them about your specific needs or wants, they're going to be able to help you figure out who to talk to and how to get those needs met while you're going through your care. The first course of treatment, whether it's the first chemotherapy session or the first radiation treatment, is really the hardest because you just don't know what to expect or how it's going to feel. The second one and the third one, or however many more you need, those get easier as you learn what to expect and you don't have as many surprises. We recommend you have an attitude of exploration, which just means you don't have to judge what's happening. You just have to observe how you're feeling and let us know. So we don't necessarily know how everyone's going to feel, and everyone's different. So you may be having a certain symptom, and it may be related to your chemotherapy or your radiation treatment, or it may not. The more we know, the more we can help. Subsequent cycles, as I said before, are going to be less stressful because you'll know what's coming more or less. And if you do feel like you're getting a surprise or something feels different on a subsequent cycle, like your second or third or fourth, that's especially important for us to know. Even if you feel good on the first one, it can sometimes change how you're feeling on the second one as the chemotherapy or the radiation treatments begin to take an effect. So being open about it, learning about it, and then just telling us how you're feeling really helps us figure out how to help adjust the treatment as you're going through it. Now, managing your medical visits. This is going to seem kind of weird, but it's important to know that you're the consumer of this healthcare product. And as you know, there are lots of other providers in the Boston area especially that can provide good care. So we want you to know that we think of you as the boss. We work for you. You hired us to provide you health care, and you could have hired somebody else. It's just kind of like on the airlines when they thank you for flying whatever airline. Well, we thank you for coming to Vernon Cancer Center. And we realize you could go somewhere else, so we're happy that you're here. We work for you. Your medical providers are really smart. They know a ton of information, a huge number of facts about cancer diagnoses and treatments and statistics, and they'll be happy to share all of those with you, I'm sure. What they don't know is which of those many facts are relevant to you. unless you tell them. Unfortunately, they don't read minds. Even if they're really smart, they can't know what's going on inside of your brain better than you do. And so that's why it's important that you tell the staff what your goals of care are and what is important to you, and ask the questions that you want answers to. It helps them if you cut to the chase. So it is true that our providers are very busy here. We have a good clinic and we see a lot of folks. So you probably will feel like you have limited time and they have tight scheduling, as you probably do too. So one of the things that you can do to help them help you is if you come to your appointment with your questions written down. I encourage you to write them out on a piece of paper, leave a little space where they can write the answer, and then write the next question after that. And then it may seem like you're being kind of bossy, but it's really great if you can just walk into the visit, or when they walk in, you show them the piece of paper and say, "Hey doc, these are the questions I want answered before the end of this visit." And that will help them narrow down the bazillion facts that they know and answer the ones that are relevant to you. People will say, "Well, I don't want to tell the doctor how to do his job or do her job." The fact is that they're doing their job by listening to you. So helping them cut to the chase, actually, they really appreciate it. And finally, if you can take notes, either you or somebody else, it's really great because the doctors actually say a lot in those 15, 20 minutes or half an hour that they're with you. And sometimes it's hard to keep track of it all. So that's kind of why I suggest leaving a little space after each question on the piece of paper, because then your friend or family member can write down the answer as best as possible. I would encourage you to ask the doctor to speak in English and not in medical terms, because that's where it's helpful for you to understand what they're actually saying. If you have any question while they're talking, it's okay to stop them and say, "Wait a minute, I don't get it. What are you saying?" And that helps, again, them focus in on making sure you understand what they're doing. It is also helpful if you do have someone write down the answers, that later when you're home or if you wake up in the middle of the night and you think, "What the heck did that doctor say?" You can go back and look at your notes and think, "Oh, right, that's what he said. That makes me feel better. Now I remember." So taking notes is really useful. And if you do it on the same page where your questions are, then it all sort of makes sense and it makes it flow a little better. Again, the doctors like it when you're active in the care. The more you can tell them what you need, the better they can help you. So, how to ask for help, or maybe not ask for help. It's important to recognize you're the international expert on you. You don't have to know why you're having a feeling or a symptom or a complication. Just knowing that you have it is enough. That's what our job as the medical team here is, to figure out why and what to do about it. But nobody knows better than you, like I've said before, what it's like to be inside your body. Never doubt that. It's also important to remember there's no such thing as a stupid question. So when in doubt, ask it out. Tell the nursing staff what you're feeling. Ask if there's anything that can be done to fix it. It is true that we can't make everything perfect. There's no stress-free or pain-free or symptom-free way to go through treatment. But the more we know about what you're feeling, the better we can help manage those symptoms. But there are no perfect solutions. And knowing that will help us figure out if we can reduce the impact of a symptom or a side effect, or we can do something that helps make it easier for you, or at the very least help you think, "Oh, okay, I've just got to sort of tough it out for this period of time and then it'll feel better." That's something that can make it easier. It is true that you don't have any obligation to reach out for help if you don't want to. We just want you to know that the support is here when you need it. It's also true that you may not feel like you need a lot of support or have a lot of questions in the, sort of once you get used to the routine. And then it's quite common to have a lot of questions at the end of treatment. So even if you're feeling pretty confident at one point, it's okay to have questions the very next visit. It's not like you have to be, if you're a good coper, you have to stay a good coper. It's just really like, we want to know and recognize, like, asking for help is a normal part of the process, and that's how we help people get better. So the feelings and the symptoms, they're all really common. It's very rare for someone to come through here and have an experience that we haven't seen before. And so if you're feeling confused or challenged in a way, that's really not a reflection on whether you're doing this right or whether you're a good patient or not. It's just, those are the normal things. And as I said in the pain episode, pain is a normal part of this treatment process. But we don't tell you, hey, listen, you had surgery, so of course you're having pain, just get over it. It's more like, no, if you're having pain, we want to know about it, whether it's physical, mental, or emotional. And we see the challenges or the the symptoms are oftentimes signs that the treatment's actually working. It shows your body's being affected by the chemotherapy or the radiation treatment. So we want you to have the best information possible about how to manage those challenges to the best of your ability. There's a whole episode on the specific people who are here to help, and we'll get to that in a later episode.